Hello, everyone, and welcome to another episode of Rock Hospital Podcast. I am Hala Hamza, and today we'll be talking about digestive health, something many people experience but don't always understand. Today, we'll break out these conditions, what signs to look out for, and when to seek medical help. Joining us today, Dr. Syed Naveed Azam, who will help us understand these conditions in a simple and clear way. Hi, Doctor.
Hello.
It's nice to have you here with us
Same
today.
here, pleasure is mine.
So to start up with, why do you think digestive health issues are very common, but we don't really understand them? Why do you think they're misunderstood somehow?
Digestive system in humans, as we understand it, is a very complex sort of process that we all eat food every day. That food needs gets digest, and then we need to take the energy and the nutrition from the food that we eat. So it sounds very simple, but if you remember high school biology, it's a long organ. It's a complex organ with multiple segments to it. So most of the time, things work well and we get on. But sometimes a small hiccup here and there can upset the system, and usually it's for small periods of time and we recover. But when it persists, things can go wrong. You get uncomfortable to start with, then there might be pain, and there might be other issues if it's ignored for a long time. So, digestive system, it's not just a simple process of eating and digesting food. There's a lot more involved, in particular terms with regard to immunity, with regard to your general well-being, not just the circulation and cholesterol issues, liver issues, but nowadays we understand that there's something linked to our mental health as well. So there's something called the brain gut axis. So this is something that's we are beginning to understand in recent years, and hopefully we will know more about it as we go along.
Okay, to start off with disease, let's start with the IBD, inflammatory bowel disease. Why do you think it's very common, and how it is different from the IBS?
Now, it's very important to understand that inflammatory bowel disease, which is IBD, is different from irritable bowel syndrome, which is IBS. So there's a lot of confusion between these terms, in the general public. So inflammatory bowel disease is a long-term condition where different parts of the digestive system have inflammation. Okay, so when you do the tests, you see whether it's blood test, stool test, or when we do endoscopies, or colonoscopies, we see inflammation in the body, in the stomach, in the intestines, in the colon, and we understand that there is inflammatory bowel disease. There's different types of it, which we can come to later. So we need to manage this differently. Irritable bowel syndrome, on the other hand, is a bit of a nuisance. It can give you similar symptoms, but when we do the tests, the blood tests and the stool tests and the endoscopies and colonoscopies, even scans, usually these turn out to be normal and we don't see any active inflammation. So that is when we call this IBS. These are symptoms that need to be managed. And the main difference I would say between IBD and IBS is IBD has to be treated so it doesn't cause complications. IBS never causes complications. It just lingers on, but it bothers you, but it doesn't lead to anything more serious.
So, can IBS lead to IBD?
Very, very unlikely unless somebody has an overlap. They have IBS symptoms for a long time and then they develop inflammation, then they have moved from IBS to IBD. But by definition, IBS will not lead to inflammation and inflammatory bowel disease.
What are the main causes for IBD?
Okay, the cause of IBD as of now is not has not been identified, but there are different theories. We definitely understand that some genetics involved. Some people are prone to develop inflammation in the gut, which is the digestive system. So for example, if somebody in the family has IBD, then there's a higher chance of siblings or kids developing IBD, although it's not necessarily 100%, but there is a slightly higher chance in general population. We also think that the nature of our eating habits has changed over the last 50 years, maybe the last 100 years. And I think there is some contribution from the type of food that we're eating nowadays that is causing an increase in IBD. A third suspected but not proven is an element of what are the gut bacteria or gut microbiome, as it calls. What is the role of these in causing IBD? So that is still under investigation. And once we know, we will understand better and we can explain it better.
For someone who has IBD, but they don't know, so most of the diseases, when we have them, we don't feel them. What are the signs when, like, someone experiences them should always
Oh,
all the way seek help?
so the two main types of IBD that we see in the in routine practice is something called ulcerative colitis. So in ulcerative colitis, the main symptoms are usually diarrhea, sometimes with bleeding. Okay. There's the other type of IBD, which is Crohn's disease. Crohn's disease doesn't always cause diarrhea or doesn't always cause bleeding, although it can. The symptoms can be a little bit more subtle. They can just be tiredness, fatigue, sometimes you're anemic. And then as it progresses, it can cause abdominal pain, discomfort, Crohn's disease, if it involves the colon, you will get diarrhea and bleeding. But if it involves the small intestine or the stomach, then it will not be very obvious. So patients get treated for IBS, gastritis for a long time. And then eventually, when they end up with a senior physician or a gastroenterologist who thinks of Crohn's disease and does the tests, that's when the penny drops.
What medical solutions Rock Hospital offers for the IBD?
Okay. We see a lot of IBD patients as of now, and if I see from 5 years ago to now, I'm actually seeing more patients with IBD, even in Ras Al Khaimah. And I think there is a lot more awareness among people, as well as a lot more facilities that leads to investigations and early diagnosis. So if a patient comes to me with digestive problems, okay, we think of a few things at the beginning, and then if we conclude that at the end of evaluation that this patient has IBD, then yes, there's a lot more treatment options nowadays, starting from simple anti-inflammatory medicines to treating the symptoms, the pain and the discomfort, and to looking at the nutritional aspects, because that's an important part of managing IBD. Most patients with IBD would have had this for several months, or maybe a year, 2 years, 3 years, and so nutritional problems could be there. So we start addressing them in parallel, and we start them on medications, and it does take a few weeks for them to settle down, but I'm pleased to say that most patients do get better as we continue to treat them.
What are misconceptions people hear about IBD, but they're incorrect or could be correct? So, what?
Okay, so the common confusion arises from not s- being able to tell the difference between IBD and IBS. As we said earlier,
Yeah.
if we keep treating IBS and the symptoms will keep coming and going, they're not settled. Once we establish the diagnosis and we take time to explain it to the patient, that this is what it is and this is what we need to do about it, most patients will follow the instructions and take it forward. Before the diagnosis, the confusion is not just with the patients, it's with their families, with everybody else. And I'm sometimes, when the symptoms are not as obvious, the confusion can be with the doctors themselves.
Yeah.
So unless you actually go down the road and try and differentiate,
Yeah.
it can linger. And unfortunately,
Could be
sometimes it
the
happens.
environment as well. The internet could like
Yes, yes.
start, deep sea, ChatGPT, all of these things.
You're absolutely right. You're absolutely right. See, most of the time, before going to see a doctor, all of us, it's a habit to go and check for ourselves. These are symptoms, and sometimes it helps, but many a times it causes more confusion.
They say
It-
always go for a doctor.
yes, so that would be my first advice. You go and see a doctor, and the doctor will do some assessment, some simple tests, and then we can come to a conclusion of say, okay, we go in the right direction or we go in the left direction. So this is something that is always better to consult a doctor.
Let's now move on into another disease, which is something also very common, the fatty liver. I always hear myths about it that only it affects overweight people or elder people. How correct are these
Okay,
myths?
the term fatty liver disease is very simple to understand. Okay, it has a range of uh, problems, but fortunately for most people, it simply means there is more than necessary fat in the liver cells. Okay, so we're not supposed to have fat in the liver cells. The liver should be healthy and working very well. As fat gets deposited in the liver cells, it becomes fatty, and we can go from grade 1 to grade 4. We'll talk about that later. But No, it's a myth that only people who are overweight get fatty liver disease. If you actually see data nowadays, I think 20% of the world, 1 in 5 people have fatty liver disease. If you look at Western countries, it's probably 1 in 4. Now, if you go on to add other risk factors like diabetes,
Mhm.
I think 40% of people with diabetes have fatty liver disease. And add to that, if somebody is overweight, then you're talking about 2 in 3 people having significant fatty liver disease.
Mhm.
So no, so it's unfortunately we see more and more of this all over the world, and
The food habits are changing. This is the.
absolutely. So why this is happening is some things are clear, some things are not clear. It's a very so if you look at weight, it's a simple thing to understand that if I am overweight and I have more than necessary or more than expected body fat, a, a significant chunk of that gets into the liver and causes fatty liver disease. If I'm diabetic or if I have high cholesterol levels, then that also increases the risk of
Could be a factor.
fatty liver disease. What is driving this? Yes, most of the time it's our lifestyle. It's the food that we eat. It's a lack of exercise and sedentary lifestyle that leads to the first two problems, the overweight and the diabetes and the cholesterol, and then leads to fatty liver disease. We see fatty liver disease in people who are not overweight, who are not diabetic,
Could affect
who
it.
are not high, who don't have high cholesterol. So I think part of it is the type of food we eat. We think it's processed foods, rich foods, fast foods are definitely contributing to this. So it's a difficult balancing act in choosing healthy lifestyle.
All right. What are the symptoms of uh, fatty liver disease?
Fatty liver disease, unfortunately, doesn't give you any symptoms.
Okay. So how are we supposed to know we got
So
fatty liver
yes,
disease?
so uh, if somebody is overweight or diabetic or has high cholesterol or is simply over the age of 40, I would advise them to get an ultrasound scan done to check the liver and get some basic liver tests done to see if there's any risk of fatty liver disease or if they already have fatty liver disease. The problem with liver disease is it doesn't give you symptoms unless there is damage to the liver.
Mhm.
When there is damage to the liver, even then, your symptoms could be very vague. It could just be tiredness and muscle aches and feeling a bit weak than normal or a bit more lazy.
Mhm.
You know, so only when you get to advanced liver disease, when there is a lot of damage that we call cirrhosis of the liver, it's only then that you actually can see yellowness in the eyes or blood tests show damage to the liver. In early fatty liver disease or simple, straightforward fatty liver disease, even the blood test could be normal. And your ultrasound scan, and maybe a newer scan called a fibroscan will tell us whether there is, fatty liver
Yeah.
disease or damage from that.
So you advise that everyone to do like regular checkups.
S- yes, certainly if there's family history, and certainly anybody above the age of 40, or people with diabetes, people with high cholesterol, or people with heart disease need to get the livers checked. Okay, that's also a risk factor for liver problems. Or anybody, as I said, is even slightly overweight, you need to get your liver checked.
What are the risks?
I don't want people to worry about fatty liver disease. Okay, fatty liver disease doesn't cause damage to the liver or any of the rest of the body quickly. It takes 10, 20, 25 years if it's not recognized and if it's not managed to cause problems. So people should not panic or get worried too much if they've been told that they've got fatty liver disease. Okay, we know that there's fatty liver disease. We need to know what stage it is, and your doctor needs to work with you to say, okay, this is the problem. This is what we're going to do about it. And most of the time, it's lifestyle issues: eating healthy, exercising more, trying to get into a good body weight range, yeah, and taking care of diabetes and cholesterol problems. There is no specific medicines that we recommend for fatty liver disease. Okay, maybe in the future we will have specific medicines, but right now our focus is on lifestyle management and treating the diabetes and cholesterol problems. And of course, there is an element that we didn't talk about it. Fatty liver is also seen in people who drink alcohol. And if you're drinking more than you should, you need to be concerned about possible liver damage.
Can it also affect the young children as well? Or less?
Yes, yes. So we do see obesity in childhood.
Mm.
And as a result of that, we are seeing fatty liver disease in kids as well. So, yes. So, uh, any child who has any health issues is certainly overweight, you know, we need to check for the possibility of fatty liver disease and catch them early and treat them early so it doesn't lead on to problems later on in life.
Okay. What treatment does Back Hospital offer?
Yes, as with any other digestive problems or liver problems, we see a lot of people with fatty liver disease. And as I already said, the fatty liver disease needs to be managed in a holistic manner. We need to address lifestyle issues, eating habits, exercise, checking and treating for diabetes and cholesterol problems. And over a period of time, we work with the patients to manage these risk factors that cause fatty liver disease and bring it down. And you see that over a period of time, it can get better as long as we keep this in mind and work with the patients to do that. So we do the assessments, we track their progress, with scans, ultrasound scans, fibro scans, and then over a period of 1 or 2 years, we can see good improvements in patients who adhere to these treatment regimens. Yeah. So yes, we can manage fatty liver disease with anybody at our hospital and work with them to make it better.
Perfect. Now let's move on into another disease, which is acid reflux. I think it happens to everyone. All of us experience it at some point. Can you tell us what is it exactly?
So acidity is a very, very common problem for most people. I wouldn't even call them patients. And for most people, um, acidity causes problems from time to time. We are all experienced. You go out for a heavy
Yeah, the
meal, you feel
burn.
uncomfortable,
Exactly.
for a day or maybe 2 days, and then you're okay. I wouldn't worry about that at all. Stomach acid is normal part of our digestive system. Every time we eat food, in fact, sometimes when we just think about food, the stomach prepares to make acid in the digestive system. So acidity is normal part of us. When we eat food, the stomach needs acid to break it down. Okay, so it depends on what you've eaten. If I'm having a barbecue,
Hmm.
I expect the stomach to produce a bit
Yeah.
more acid. But if I'm just having uh, some rice or a sandwich, then I probably don't need that much acid. So most people don't actually produce excess acid. They produce The stomach produces the relevant amount of necessary amount of acid to help that what we've eaten, to digest what we've eaten. When it is excessive or when it lasts longer, you feel uncomfortable in the stomach. There could be burning, there could be discomfort, and reflux is when the acid or whatever is in the stomach comes into the chest. So that's what reflux means. It's going in the wrong direction. So the food pipe is more sensitive. The esophagus, the food pipe is more sensitive. So if we have acid in the stomach, we tolerate it much better. When it refluxes into the chest, it causes a lot of heartburn, symptoms, burping, discomfort. And if it is going on for a long time, uh, it causes more severe symptoms.
When do we feel like we need to check a doctor? Because it happens to all of us, but when do we feel like, oh, it's getting dangerous? I need to.
If the symptoms are for a day or two, and you don't even need medicines and it settles down, I'm not worried about it. If it's happening more than that, 3 days or more after one episode. So a lot of people go to the pharmacy and take some simple antacids, and it gets better, and it doesn't bother them for a long time. That's okay too. If it's happening frequently and it's not getting better with simple medicines from over-the-counter medicines, or if the symptoms are getting more severe, so it was say 3 months ago, last month you had minor symptoms, but now the symptoms are more severe. So, more frequent symptoms, more severe symptoms, or persistent symptoms, I would definitely go and see a doctor.
Can food help when this happens? Let's say it's not severe yet, but food, for example, like milk, when it happens when you drink milk or eat an apple, it can like help. It calms down the.
Certain foods can certainly cause reflux symptoms or as gastritis symptoms. Certain foods can help with them. For example, you mentioned milk. Milk has been traditional for years and years and decades. Even from grandmothers, you can hear that if you have a gastric problem,
Drink milk.
drink a bit of
Yep.
milk. That's interesting because milk has an alkaline effect. It helps neutralize the acid in the stomach. So that's why it helps. But yes, it's a short-lasting effect. You can try that. The foods that cause more symptoms is more important, I think. If generally we look at triggers. So there could be many triggers, but the common ones are
Lifestyle
lifestyle.
factors. Yeah.
So spicy food is a big trigger. Eating late at night, and sleeping after we have eaten
I
is a
think
trigger.
all those people think.
Is a trigger.
Yeah.
So the advice that I give to my patients is for at least 2 or 3 hours before you sleep, do not eat.
Yeah.
And if you eat dinners, the dinner should be the lightest meal of the day.
Yeah.
Yeah. So spicy foods, eating late, and then of course there's two big culprits, which is smoking and alcohol. They trigger symptoms a lot more in a lot more people.
According to this, does it also only affect, let's say, from 20 till, let's say, 50 age
The acid reflux symptoms, no.
because of the lifestyle factors?
It's certainly more common, but acid reflux can be in young children.
Can happen to
It
anyone.
happens to old people. It can happen to anybody.
If it's been happening for so long, what, like, anything can develop?
So most people, when they get symptomatic, when the symptoms are bothering them, they go to a doctor, they get some treatment, sometimes for a couple of weeks, sometimes for 2 3 months, and it gets better. And it doesn't bother them again for a long time. If symptoms are either not treated or not getting better with treatment, then you will need to evaluate it a bit more, to make sure that there's nothing else that is causing. Sometimes there are mechanical problems, like a hiatus hernia that is causing reflux symptoms. So if that is there and we do the assessments, we do some x-rays or we do endoscopies and look for these conditions, and that can be treated in addition to medical treatment, and then it gets better. The problem is if we ignore it for a long time or leave it alone, chronic reflux can cause damage to the lining of the food pipe. And in some cases, if it's been going on for 10 years or more, it can cause these changes. It does lead to what we call precancerous changes, and unfortunately, in some cases, cancer of the esophagus as well. It is not very common, but it has been noted, and we see, I would say the risk is about 1% over 10 years. So it's a small risk, but we need to make sure that, people are not progressing to that.
What lifestyle tips would you like to give to avoid acid reflux?
Okay, somebody who has acid reflux, as we already said, you have to identify what foods are triggering it for you. Commonly spicy foods, we need to avoid that. We need to avoid eating heavy in the evening and, certainly not eating late in the night. If you're a smoker, you need to stop smoking. That's a big, big change that you have to make. Alcohol does the same thing, drinking sensibly or not drinking at all is a better solution. Weight is a big problem. So people who tend to have abdominal obesity, people whose weight is bearing down on their stomachs, they are more likely to get acid reflux. So certainly, making sure that your weight is in the healthier range will reduce the symptoms. Anything that causes straining can cause acid reflux. So you can do this ourselves. You can work with your physician and address these problems. But in the long term, this not only helps with acid reflux, it helps with a lot of health problems.
Yeah, exactly.
Yeah.
So let's conclude with liver and stomach. Our stuff can be also related, let's say, with nerve system. If you're feeling upset or sad or angry, it can affect your stomach. You
Yeah.
feel like cramps maybe in your stomach. What causes that?
So this has been something that's been observed for generations. That if you have a healthy mind, you have a healthy gut. If you have a healthy gut, you have a healthy mind. So this has traditionally been there in most cultures. But now there's a lot of research going on into what's called the brain gut axis. Like the brain has it's a nervous system. There's neurons. We now know in recent decades that, the gut, the digestive system, has a nervous system of its own. And there is constant communication between the nerves of the brain and the nerves of the stomach and intestines. So when everything is working fine, it works in harmony. When there is changes, either because our food is different, or we are stressed, or the gut bacteria are different, there's a lot of signals, and this harmony is disrupted. Fortunately, most of the time it's for a short period of time, and the body is wonderful. It's a wonderful creation. It can repair itself and get back to normal,
Yeah.
and that happens in a lot of people. So for example, if I have an exam
Oh,
tomorrow,
stress.
I get stressed and I
Yeah.
might have a bit of
You
diarrhea,
can't
a
eat.
bit of tummy cramps. I don't want to eat food. But 2 or 3 days later, I'm back to normal.
Yeah.
That's normal.
How to deal with that when that happens?
Uh, Getting less stressed about everything certainly does help. Look, whatever we can do ourselves, self help. is the best way, because the person who's feeling the symptoms best understands what is happening. If it's not understandable, if it's bothering you, you go and talk to a doctor. Go and talk to your physician. Go and talk to your gastroenterologist, because we see this all the time, and we can work our way. We can talk to each other and then figure out, okay, this is something simple that we can just watch and it'll get better, or is this something that I need to check a little bit more? So having that discussion is very important.
Can vitamins affect that?
For somebody who's eating a healthy, balanced diet most of the time, I wouldn't worry about nutritional problems. If we are very restrictive in our eating habits and there's a risk of malnutrition, either you're losing weight or it could be micronutrient deficiency, like vitamins and minerals can be low. Yes,
Or iron?
iron, vitamin B12, or we see this a little bit more often in people who are vegetarian, where there could be some vitamin deficiencies. And this over a period of time does upset the digestion, because we need these vitamins for maintaining healthy metabolism. If one of them is low, you know, it disrupts the harmony again. And it's a simple thing. We can check and find out and address those. If it's dietary issues, we address the dietary issues. But in some cases, we do find digestive diseases that we need to address.
Good health, good food, good lifestyle.
As I always say, good food, good mind, good life.
Thank you so much, doctor, for
You're
this
very
great
welcome.
information. It's been amazing talking to you.
Same here.
Thanks to our viewers and listeners, and see you in the upcoming episodes.